Good morning, everyone. Can everyone hear me? I'm getting nods from the people I can see. That's great. Well, we're going to jump right in. I want to welcome everyone to the April Gerontology 101 webinar for the North Central Region Aging Network. This one is called Creating Aging-Friendly Communities, and this is a project that we have been working on here at the University of Wisconsin Extension for years now, thinking about how we can help communities develop their ability to be aging-friendly and livable for everyone, not just people who are aging and people who are getting older, but for everyone who lives in the community. And to help us talk about this, I am happy to introduce my colleagues here at the University of Wisconsin Division of Extension, Karen Dickerell, who is an extension educator for Outagamie County, Jane Jensen, who is an extension educator for Sheboygan County in Wisconsin, and Sarah Ritchie, who is an extension educator for Oneida, Vilas, and Forest counties here in Wisconsin. And myself, I'm the state specialist in family and financial well-being in middle and later life for the University of Wisconsin Division of Extension. And so with that, I am going to pass it off to Karen to get us started on what we need to know about creating aging-friendly communities. Karen, we can't hear you. Technical difficulties, folks. Of course, we're going to have them, so hold on one second. Did you mute your mic manually? Still can't hear you, Karen. Thank you for bearing with us, everyone.
Can you hear me now?
Yes. All right.
All
let's
right.
go.
There's a little button that I must have pressed. Sorry about that. Good morning, everyone. It's great to be with you and to share our information and the work that we've been doing in Wisconsin. That first question of how prepared are communities for the impacts of a rapidly growing population, we do know that there were 76 million people born between the years of 1946 and 1964. And so the traditional window.
Karen, we lost you again.
Am I back?
Yep.
I'm going to have to move that button. Okay, so 76 million people were born between the years of 1946 and 1964, and the traditional window for what we know as the baby boomer generation. That means that we'll retire over a 19-year period, and that's going to have some impacts on our communities throughout Wisconsin, and I would venture to guess throughout the communities where you live and serve as well throughout the various states that are represented today. So through lots of calculations, they're predicting that about 10,000 people a day are turning 65, and that really is having a impact as we look at our future. Beep. So the questions that guide us today are what are some of the indicators of the population aging? And then what are some of the impacts of that population that are aging in our communities? How do we define and look at an aging-friendly community? And then we're working in our communities to think about what steps can a community take to become more aging-friendly, and what resources are available for those communities. So those are some hard questions for community leaders and decision makers to make, but they are ones that we're very thankful for, the ones that are thinking ahead and looking to the future. Aging in place. We know that the majority of our Americans, as we get older, we want to age in place. And between 2011 and 2012, only about 3% of the people age 65 and older actually moved someplace different than where they had been working when they retired. So many people may travel, but they still want to come home. They want to have that community to come back to. So with this in mind, every community, either rural or urban, and we'll be talking about those today, will have to adapt to an increasingly older population. So the population, as we look at these trends, as I said before, 10,000 Americans are turning 65 every day. That's a trend that'll continue for the next 20 years. And that's something that really has an impact on us. So by the year 2030, 65 plus are projected to be 72 million people. That would be 20% of our population. By 2050, the 65 plus projected to be 80 to 90 million people, and those 85 and older, close to 21 million, for a total reaching 110 million people over the age of 65 and older. So the question is, how prepared are we for that? Our U.S. expectancy at birth, when we look at some of the trends there, we know the influenza epidemic had a great change, but as you can see, our life expectancy is changing over time. So people are living longer. For women, 30 years have been added to the average length of life from 51 to 80. And for men, the gain has been 28 years from 48 to 75. So that in itself has also changed things. There's an increase in the number and the percentage of life expectancy. Several factors contribute to that doubling population number. It's the arrival of those baby boomers, which bulge into that age from 2011 to 2029, and that's going to swell as our 65 and older group continues to increase. Increasing that life expectancy means that a higher share of people reach the older age brackets, and because of that life expectancy, 65 continues to increase. Those who make it to 65 live longer, and thus the population growth is sustained over time. So the population could grow even faster than the Census Bureau forecasts if higher life expectancy gains are achieved through behavioral change and scientific kinds of changes. In 1950, fewer than 1 in 10 were 65 or older. Today, about 13% of the population is 65 or older. And by 2050, 1 person in 5 will be 65 and older. So all those statistics are helping us to move forward in knowing that this is a critical area for us to be programming in. Beep. The percentage of people expected to survive, again, is, as we said, these are projections, but we know that we're expecting that people are going to live longer, and that's going to have an impact on the resources and the different kinds of things that we're offering in terms of programs in the communities where they live. Beep. The growth of the and I practiced this last night, centenarians in US and worldwide. So we look at those trends and we see some of the increases there. And this is from the Pew Research Center. The first chart is worldwide increase of centenarians from Pew Research, published a year ago or 2 years ago now. Greatest increase is in China and Japan. The US map shows a comparison of states from 2010 census and the share of their populations. And we know the census will be conducted next year again, so we're going to get some new data there. And the Northeast and Midwest have proportions that were higher than the national average of 1.73 per 10,000 people, while the West and the South have proportions that were lower. The regions with the most centenarians was the South, followed by the Midwest, Northwest, and the West. So we know things are changing. Our projected populations, the elderly population, age 65 and older, will increase rapidly in every 5-year interval. So you can see there it was almost 1.5 million. And that increase makes a difference then as people are living longer, they're in their communities longer. The next slide shows us a comparison from 2010 to what's projected in 2040, and consolidating the age groups had 3 broad categories: under 18, 18 to 64, and 65 and older. So that allows us for some comparisons to look at how things are changing and what kind of services and considerations do we have to make. It's also maybe Within that number of the young elderly, which is now 65 to 84, we're going to see that that's almost going to double. So the information and the changes that are coming with the demographic projections are helping us to set the stage. So if we look at the next slide, in Florida, they're ranked first in terms of percent of population age 65 and older. Wisconsin is ranked 22, and I don't know what states are on today, but I would challenge you to find out where your ranking is for your state. And then our change in between in our counties are kind of telling there on the slide that you see between 2015 and 2040. The one county that I'm going to point out is Door County. If you look at Wisconsin as kind of a hand, I know Minnesota, you have the hand too, but in Wisconsin, if you look at the hand and the thumb, that's Door County. Oh, there, thank you. And that's where we've got a lot of people that have, if they've moved there to retire. And so the services are needed there. We also see in the northern part of the state that we've got some increasing needs there as well. So turning it over now to Sarah.
Okay, within the next 25 years, the percentage of aging people in Wisconsin who are 65 and older will rise from 13.7% to more than 20%. And that number will increase from 800,000 to almost 1.5 million. As Karen already mentioned, in the term of percentage, some counties, especially in the northern parts of Wisconsin, will have elderly populations that are more than twice what Florida is currently at. So I'm going to have you interact a little bit with us. So in your chat box, what do you think will be some of the impacts of population aging on your community? What kinds of things will matter 10 years from now? And I'll give you all a couple of minutes to do that. Healthcare, transportation, assisted living residents. Okay, opportunities for economic engagement, transportation and healthcare. In-home alterations to allow aging at home, okay, built environment, workforce needs, physical activity opportunities, more transportation, and access, yeah, to local facilities, grocery and pharmacy. Support for families caring for the aging, yep. Resources, intergenerational opportunities.
Sarah, I think they're going to hit on everything.
I know. This is great. You guys have some great things. So we'll just move on, I guess. Next slide, please. Okay, so we just went over some areas that will affect the community life as we age. Consider if there's a significant increase in the number or percentage of people that are 65 and older, and how these become even more critical when the entire community is aging. So I'm going to go over a list of categories of areas areas that community life is impacted by population aging. So as I go over these 13 areas, kind of be thinking about what your community looks like. So housing, is there enough affordable housing? Transportation was mentioned. Is it accessible? Do you have public transportation or services for transportation? Sidewalks, are they maintained well? Are they safe? Are they in areas that they should be in? I know in rural areas sometimes we don't always have sidewalks. Community health care, health and care resources. So thinking about the number of insured people over 65, the availability of healthcare, is it affordable? Family caregiving, is your community supportive of family caregiving? Are employers supportive of family caregiving? Nutrition and wellness, are there services available for that? Home delivered meals? What's the rate of food insecurity among your older populations? And then arts and culture and lifelong learning. So are there opportunities in your community for older adults to engage? We're going to be going over some examples in our communities of some things that kind of cover some of these areas as well. So employment and workforce development, do your employers in the area support an aging workforce? Do they allow for job training, flexibility, inclusiveness, public safety and emergency planning? Are first responders, police officers being trained in detecting elder abuse, dementia? Are emergency plans for your community considering the different needs of an older population? Respect and social inclusion. Is there outreach to some older adults in rural parts of your community? Do they have places to go? Churches, meal sites, things of that nature. Community connectedness. Are there opportunities for older adults to get involved? Are there volunteer opportunities for them? Taxation, finance, protection against fraud. Does your community offer opportunities to educate on finances, on fraud? Are there fraud alerts that go out? Are there programs for tax assistance? And then the last one, community leadership and intergenerational collaboration. Does your community have programs that incorporate intergenerational things, community engagement opportunities and things like that? So just some ideas for you to think about for your communities. So to this point, we've illustrated the aging of populations and listed impacts on the families and communities that we serve. We turn now to the third portion of the presentation, the challenge of creating aging-friendly communities. Our intention here is not to provide solutions, but to begin a dialogue about what makes a community aging-friendly and to encourage careful assessment of where communities are in terms of being supportive to the needs of people of all ages, including those who are and will be older. So we asked two questions. What are the key attributes or characteristics of aging-friendly communities? Meaning, what criteria can you use to tell if a community is supportive? Is it a supportive place to live for people of all ages, including those who are older? And then number two, how can you tell the extent of which your community is aging-friendly? How do you measure that? So here are some key attributes of an aging-friendly community. The summer 2009 issue of Generations, a journal published by the American Society on Aging, was devoted entirely to the topic of creating aging-friendly communities. One of the articles in the issue, Thomas and Blanchard's piece entitled "Moving Beyond Place, Aging in Community," describes 6 attributes of aging-friendly communities. Aging-friendly communities are usually characterized by 6 traits or properties, and they are inclusive. So people of all ages, races, ethnicities, and abilities, especially elders, are welcome. Sustainable. Residents are committed to a lifestyle that is sustainable environmentally, economically, and socially. Size matters. People need to know each other, and the scale determines the nature of human interaction. Small is better. Healthy. The community encourages and supports wellness of the mind, body, and spirit, and to the same degree, plans and prepares programs and systems that support those dealing with disease, disability, and death. Accessible. The setting provides easy access to home and community. For example, all homes, businesses, and public spaces are wheelchair friendly and incorporate universal design features. Multiple modes of transportation are encouraged. And now I'll hand it over to Jane.
Thanks, Sarah. And these steps, these are 6 steps that a community can take to become more age-friendly as you try to answer these 2 questions. 1, how can you tell whether your community offers a supportive environment for persons of all ages, including older adults, or in other words, livability for all? And 2, how can a community measure or assess the extent to which it is aging friendly? And the first step, and I'll interject a few examples from my local situation, but the first step is to assemble that team of public and private leaders and stakeholders to increase the awareness of population aging and do some education in that regard. And so in the city of Sheboygan, and mine was a city example, that included folks like the mayor, the city administrator, city department heads, city planning, transportation, the senior activity center director, economic development, the library, and of course extension, and I'll talk a little bit more about that later. And we did need to do some education because some folks were not aware of the effects of population aging were happening locally in Sheboygan County. I think folks tended to think of Florida. They tended to think of, you know, some of our counties, you know, up north. And that second step, then how can we assess the extent to which the community or the county is aging friendly? And there are several assessment tools in our toolkit, our facilitation guide, which we'll talk a little bit about later. But in the city of Sheboygan, we used a combination of AARP's Livable Communities tool, the city's strategic planning survey, which they engage in every year, but then on every 3 years, a very extensive survey, which was great to have at this particular point in time. And then, of course, our assessment tool through UW Extension. And then other tools like listening sessions, you know, going to community events like the Hmong New Year, gatherings of Latino residents, that kind of thing. So as a result, and we're pulling all those priorities together, we're beginning to develop focused action based on those priorities, and then to promote and communicate our successes. In fact, we're planning a super cool gala later on this year and this fall, and then looking at our long-term course and obtaining those resources, which we were able to obtain some, you know, resources through the city, through AARP, because we became one of those livable communities. And with this call for action in mind, we're really posing 3 questions to all of you. You know, is your community a good place to grow up and grow old? And will the community meet your needs? You know, whether you're 25, 65, you know, 105. And if not, what can you do now to begin to make your community a friendly and supportive environment for people of all ages? And ding, in the next slide, we've got a great picture of Madison, I think. But let's learn about some amazing initiatives from my colleagues that have occurred all around the state to look at ways to become aging friendly or livable for all ages. And so now we will move on to my colleague Karen.
Now you can hear me, right? So the attributes of an aging-friendly community, we talk in our communities about what can we do to think about what the needs are. So we invited community leaders to various meetings throughout the state. And we looked at a participatory kind of experience for them, where they use the clickers for the participants to vote on whether the community exhibited each of the characteristics of where they live and what they were representing. Is that community inclusive? Is it sustainable? Is it healthy? Is it accessible? Is it interdependent? And is it engaged? So by looking at and using those clickers in the room, we had in Outagamie when we did it, we had maybe 30 people there. It was instant research. on what the perceptions were of the people, the leadership that was in the room. And it was kind of exciting to see that come to life, because sometimes people take surveys and you don't know about it for a while because it takes a while to compile it. And this was immediate, and it helped also various communities. We had small communities as well as people from the city of Appleton, which is not metropolitan, but it's more urban. So they could compare and look at the services that they had. And we also, Outagamie County is the home of our county seat is Appleton, but Appleton is actually in 3 counties. So some of you have those similar kinds of relationships too, that, you know, it's not a clean-cut kind of government system of who's going to fund what. And so it was helpful, I think, for these communities to see how they interact, and how maybe counties needed to work together and how municipalities needed to work together with this common thread. Cliff Barber was our specialist at that time. He's now retired, but he's very excited to hear that his work continues on, because I just saw on Facebook last week that, yeah, he's engaged still, even though he's not living in Wisconsin. He's still our godfather, maybe, of watching what we're doing. Moving on, this gives you an idea of what we're doing in Outagamie County. We created a caregiver coalition, and this isn't unique in Wisconsin. Many communities have these caregiver coalitions, but knowing that it does take time to identify the needs. So having done that needs assessment, that was very helpful to us as we moved forward. And the needs assessments and caregiver cafes were built on the involvement of caregivers. We did some worksite involvement, and we've also looked at our missions and visions and values as we look at what the voices of the caregivers are in our community. So one of the pictures there is at a caregiver event that we have in Appleton. It's an appreciation. And so we have modeled it on World Cafes. So we had different questions at each table. And we ask those questions of the people, have a discussion, and then they move to another table with a different discussion leader and discussion. And we want to, as you can see, some people say, well, what are those toys doing on the table? They're peripherals. They're things, manipulatives that help people. Sometimes it's, you know, when you're talking about your loved ones, it's very difficult. So it gave them something to do with their hands and to shape and mold. And many of the peripherals related to the questions that we were asking. So it's those kinds of touches that help them. The other picture that you see there is Tim Gerke. He's our area manager for Social Security. He brings people in and helps them understand. And these folks were part of a resource fair. And in Hortonville, and I'll talk about Hortonville a little bit, but to have that size group for that little village was really exciting to see. Moving on, there's Hortonville. That's the community center. It was built, and the community leaders thought, we'll build it and they will come. Well, they didn't. So we found that we needed to make some assessments. They thought, well, you know, now we've got this beautiful building. Why aren't the senior citizens, the chronologically gifted in our community, why aren't they taking advantage of this? It's a beautiful facility. The library is there. We've got this meeting room, but people weren't comfortable. They didn't have the relationships. So we did some assessments. One assessment was done at the ribbon cutting for the building, but we also did it at polling places when they came to vote, and we got information about what they wanted. One of the things they wanted, you know, it's all about food, I guess. They wanted to have potlucks. And so they've got a monthly potluck that they've been doing now for 3 years, and they have really built a community of people. From that, they also now have a birthday club. So every month they celebrate people's birthdays of the month. And then they play games. In Wisconsin, sheephead is really popular. So they've got a table of sheephead. They've got a table of puzzles. And I think there's another one of dominoes. So they're building their community to the point now that when we brought a meal site to Hortonville, it wasn't big enough for this site in terms of the needs and things, but now we're building on, again, getting people to come to the meal site. We've got many home delivered meals, so we know that that's still a very important critical need, but now we want people to come to the actual meal site. And what we were hearing is they say, and this is like 80, 85-year-old people saying, well, that's for the older people. So we're trying to help them see that it's not just for old people or older people, it's for community. It's to come together. We have seen some leadership development. I'm very excited to say that we've got a senior team that has been doing some of this planning here in Hortonville, and one of the members was just elected village president. So we see those kinds of things happening over time as people gain, you know, their interests and confidence in what they're doing. And again, the bottom line, food seems to bring them together. And so we're building on that. The World Cafe, that, as I said, we've been doing that in a number of settings. This was one of the World Cafes that we did a couple years back. It promotes the conversation and the dialogue, and it's a great way for learning and coaching. People oftentimes see that they're not alone. Sometimes they think that they're the only one. Or we hear spouses say, but when I took my marriage vows, it was death do us part. And so this, we supply markers and table, you know, paper on the tablecloths for large notes. And sometimes we, depending on the group, we have them doodle and draw. And it really, the final round, as they're moving from table to table, when we come to the final round, that's where we share the discoveries, because people have been mixing up and getting to know people in different ways. We've done this at work sites. We did it at Thrivent. We did it through Outagamie County, through our employees. And the administrator's assistant said, well, why would we do a caregiver cafe for employees? They're working. And I let that sink in and pause. And he went, oh, okay. They need support too, don't they, Karen? I said, you got it. And if they're not concentrating on their work because of distractions and things that they're worried about as a caregiver, we need to help them and support them. So I think we have one more slide. Ding. Yes. So this is Northwoods Cafe. This was a major shopping mall. We had 2 major anchor stores close in the last year, but it's still a place that people come in the morning to walk. It's a great indoor thing for winter and when the sidewalks aren't safe. So we did a little study there of who was coming, found out they were walking. And so the second Friday of every month, we did a caregiver drop-in center there in the food court. And we got to be kind of known as a staple to the point that, but we weren't getting huge numbers, so we discontinued it in December, and wouldn't you know it, people came looking for us. So we're now in the process of looking at other ways to reach out to caregivers and meet the people in the community where they're at. So we're doing some work with a local church that had been a daycare, and now they're looking at the other spectrum of how they can better accommodate the needs of aging community members. And so we're looking at what we might be able to do to accommodate some of our discussions there. So that's basically Outagamie County, and we'll move on to Sheboygan County.
Great, thanks, Karen. And I'm going to be talking a little bit about our aging-friendly excuse me, Liveable Task Force of Sheboygan. And again, as I said, this was a city initiative. And actually now we're calling ourselves Sheboygan for All. So something we talked about, we really wanted to be inclusive of all ages. And so if we go to our next slide, we're really asking ourselves, are we really ready? And so in the city of Sheboygan, the city had already made application to the AARP network of age-friendly livable communities, which really means that the elected leadership, and in this case the mayor and the city council, has made the commitment to actively work towards making the community a great place to live for all ages. And so that application had been made. The mayor, the city council had made that commitment, and so it was accepted into this network the end of 2017. And so again, as I said earlier, it included other folks being brought together, like the senior center director and the city administrator and the planning and library and city council members and economic development and city department heads as they looked at strategic planning. So everybody needed to be on board in that regard. And next slide. Yes. And so in 2018, the city of Sheboygan was engaged in a rigorous every 3-year assessment strategic planning process and had already made that, excuse me, commitment to working towards a more age-friendly, livable community. And then we found that our UW extension assessment tool in our toolkit facilitation guide aligns really well with the 8 AARP domains of a livable community. And so that all lined up really well. And so it really took quite a while. I will say one of the, sometimes there's some really hard work, in collaborative efforts, but to create an assessment survey tool that met the needs not only of the city of Sheboygan and the city administrator and mayor, et cetera, but also AARP, because they have some pretty specific requirements in terms of which questions or which things need to be looked at. And then also the Sheboygan for All Task Force and of course UW Extension. And I was part of that creation of that tool, and it did take a while to massage and get everybody on board, and everybody was accepting of all that, and also the AARP representative here in the state of Wisconsin working with that particular process. And then we were able to open the survey last November, and it was distributed electronically through AARP members. I was astonished how many AARP members are just in our locale alone. Many more than I would have ever thought, but also through the city website, again through community events on paper. So also paper surveys at the Hmong New Year, specific community events with our Latino community contacts, and also the city administrator was able to provide some incentives as long as people indicated their names and contact information, so they could get chamber bucks if they, came into a drawing. And then also those other community listening sessions, which were held, kind of community input sessions and coffee, paper surveys. And it was important to compile those results. The city council really needed to see them first, in terms of being very supportive. And so we're currently working on creating those action teams based on the expected priorities, because now we're in that action planning year, and created a mission and vision. It will be a fairly long process. And I think what's really exciting, one of the latest developments as our senior activity center director is retiring, when they rewrote the position description for that director position, it was rewritten and needed, of course, to be approved by HR and the city council, et cetera, to include livability work and providing leadership for this kind of work. So I think that's really very, very exciting. So that's kind of where we are. And it's a long process with this many players involved, but hard work, but very creative work and satisfying work. And now Sarah has some neat examples from northern Wisconsin. Thank you.
Yeah, so Iron County is really one of the furthest north counties in Wisconsin. And it actually has one of the highest aging populations in the state, if not the highest. Because I haven't seen that data recently to see. I'm not from that community, so I'm just reporting out on it. But in Iron County, they use the assessment with their community to see what their older population was interested in, and they found that there was not a lot of opportunity for lifelong learning. And that curiosity never retires. So one of the barriers to lifelong learning in that area in rural Wisconsin is that it was very expensive. The other opportunities that were somewhat nearby, there's a university, and then Nicolay College is in Oneida County, so over an hour away, so too far. It was too much of a time commitment for them to attend some of these programs very far away, and they needed more for cognitive engagement. So those were some of the barriers that they saw. So from that, they were able to kind of create their own, what's called FE University, so Iron University. So it's structured like a regular university. It has different terms. Instructors are paid a small stipend, and some actually just volunteer their time because they enjoy teaching programs that are in their interest areas or in their expertise areas of what they may have retired doing in their previous life. Students pay $3 per class or per hour of class, and there are scholarships available to those that may not be able to afford to attend. I believe this effort started around 2015. I think the idea of it and the planning around it started maybe a year or so before that. So the program's still going strong. In their first year, they offered 5 classes with a total of 35 students. Slide. Oh, okay. And so there's a lot of value around lifelong learning opportunities and connectedness in rural areas. Personal value has social connectedness and is important for relationships. They can be they can be a source of fun and support. They help people feel that they belong, that they're included, and that they play a part in society. People who feel socially connected also contribute towards building communities and society. They help to create what sometimes is called social capital. The networks that help society to function effectively. So there you can just see some examples of the value for the individual and for the community. And here's an urban example from Karen.
Moving down to Winnebago County, that little blue blog, go back. The little blue there is Lake Winnebago. And so the yellow is Winnebago, and on top of that is Outagamie. We're real close to Green Bay. If you know about the Green Bay Packers, if you've ever heard of that National Football League, we're pretty close to that. So we oftentimes do programs together with Calumet, Outagamie, and Winnebago County. And so this example comes from Chris Kneep, who retired. She's professor emeritus now. But they did a needs assessment, and they did a community with the clickers kind of event. And they found that transportation, accessibility, and parking was a critical issue in Winnebago County. When they asked how many of the listed aging-friendly characteristics does your community have in the following area, they saw that transportation was an issue in the accessibility. And namely what came with that, in the next slide, you'll see something that we've got in Wisconsin called roundabouts. And I think you probably have them probably in some of your states too. It just kind of became a real popular thing about 3 years ago of how to think about how we can prevent more accidents. So if you look at that map there, Highway 41 is now I-41. And to the east of 41 is where many of our elderly population live in Winnebago County. But on the west side is where the hospitals, the clinics, and many of the other services are, the grocery stores, the bigger grocery stores, that kind of thing. And also, I think, some high schools and whatever. But for the aging population, many of them had to cross over 41. And it's not just at this, you know, at one, it's like almost every major roadway to get on the other side of Highway 41 without swimming Lake Winnebago is going to be through roundabouts. So there was a big educational opportunity for learning how to drive through the roundabouts. And they don't have single lane roundabouts. If you've been in Oshkosh for the EAA, the experimental, you know, it's like 2-3 lanes, and then there's a roundabout to a roundabout to a roundabout on one side. And so what Chris did, and working with Department of Transportation and her planning department, they got these big maps, and she went to the store and bought little Matchbox cars, and people actually practiced after they were explaining to them what the safety issues were and how do you use a roundabout and the importance of yielding and staying in your lane. They had people actually take the little matchboxes, and they kind of, you know, it was fun. And it wasn't demeaning. It was like, okay, I'm going to be in my car. I have to think this through. And so they learned how to drive through the roundabout. So that was just one way of addressing an issue. We have people in both Outagamie and Winnebago that will not go through roundabouts, and they will go out of their way, or they'll go to other services and other communities because they don't want to drive through the roundabouts. And that's something that we bring up in our meetings in multiple counties here, about how are we making services available, and transportation. The roundabouts are one thing, but transportation for people is another major issue that comes up at almost every planning meeting we've got in Hortonville and in the village of Little Chute, about how can people, if they don't drive any longer, how are we matching them? And we have several really great transportation programs, but we don't have enough, because those that have those medical appointments, they have them, they're set dates, and it's really hard to have a structure in place for them that they feel comfortable with and looking at. So this whole idea of transportation is important. And again, in the village of Hortonville, they have a new village administrator. He's looking at incorporating, enlisting volunteers, and actually the village having cars in their fleet available for transportation for their seniors. So that's just one example of how transportation comes to life in realizing what's needed for people that maybe can drive, but also those that no longer can drive, and how we can get them to where they need to get to for their services. So our slide here is, how can you be a catalyst for action? Are you willing to wake up and take the risk? And what will you be doing in your communities so that you are part of the puzzle piece? When we did this presentation in Minnesota at the National Health Institute, we actually gave our people in the audience puzzle pieces and asked them to kind of fill out the puzzle pieces of what you can bring. What are your skill sets? What is the research that you have in the work that you're doing and working with community members and leaders? And it may not only be in family development in your offices, it may be working with youth development, and how do we connect those resources together? It may be working with our ag agents, agriculture, and how do we connect the rural parts of the community and our community development educators, and how do we enlist the services and the talents of everyone to bring people together so that we can look to the future, look at what the demographics are telling us, and how are we going to move forward.
So, Karen, I think it's passed off to me now.
Yes, it is.
Yeah, just checking.
Okay.
With that, we just want to tell you a little bit about a program or a survey that we have developed here at EW Extension to help with this. And this is just one of many, but we have a program of a survey of aging-friendly community characteristics, which essentially takes communities and walks them through each of those 13 domains that we opened the presentation with, and has them think about how much their community meets the needs in those areas. And so there's different characteristics that are listed within each domain. And let me get my laser pointer here so I can point out on the screen, because this shows some examples. So the example here is for community health and healthcare services. And you can't read the whole thing, but just to show, there are some bullet points that detail what some examples are of characteristics that fall within that domain, and asks people to think about how many of them their community has. Does their community have all of these characteristics? Does it have a few? Does it have none? Which helps them think just more in detail and more critically and with more specificity about whether or not their community is meeting the needs of older adults and really everyone in the community based on each of those unique domains. And what's useful about that is that it really brings that detail to it and that level of thought process. And there are a lot of different ways that our communities have used these surveys. A lot of times it is a conversation with a leadership group, with a strategic planning board, with a coalition, to facilitate the process of having the leaders think about this and put themselves in the shoes of older adults, like with that transportation example, to help them think about the challenges that people in their community might face that they may not be thinking about if they aren't looking at it in detail. It's also been used as a community survey to get that information from individuals in the community and figure out what it is that their perspective is on these issues. Because what the leadership sees as being something that is well met by the community may be different from what individuals in the community believe exists and know about. And so this is a way to help structure the assessment of these different characteristics. It's not the only way, but it's the way that we've come together and that we've used and that many communities have found helpful. And so if you're interested in this, you are welcome to go to the website where we have what we refer to as the Facilitation Guide. This was a guide that we created to help extension educators, and it was specifically geared towards Wisconsin, but you are all welcome to take a look at it as well, to help educators figure out how to use this, because every community, every county, every smaller community within counties has different needs, and they're at a different place. And so that ranges from starting with just letting the leadership and community members know about what aging looks like in their community and letting them know about how that's impacting their community, getting them to think about that and getting them excited about affecting change in those areas, all the way through to helping them think through specific characteristics and specific domains that they're particularly interested in, like transportation, to do some problem solving and some really in-depth thinking to figure out how to solve those high priority issues. And the key goal is not to direct what the community is going to do, but it's to facilitate that thought process and facilitate the conversation to help them affect change. And so in this vein, I think it was just a week or two ago, we published a feasibility assessment of this Creating Aging-Friendly Communities guide, where we surveyed educators in Wisconsin to figure out what they thought about this tool that we had created, this facilitation guide, whether or not they thought this kind of programming would be useful in their communities, and whether or not they wanted to do this programming themselves. And what's really interesting is that our educators almost universally said that this was important, that it would be helpful for their communities, that it was a need in their communities, that it was feasible, and yet many were not interested in doing this work. And so that's interesting to us for a lot of reasons. We don't entirely know why. Some of it is because we've been going through a reorganization and people may not be willing yet to put new programming into their bucket. Now we've come through that and we are reorganized and we are hitting the ground running with that. So that may change. Some of it may be that they just don't know where the boundaries are, because this is an issue that is interdisciplinary. It overlaps health and well-being, it overlaps human development and relationships, it overlaps family and consumer sciences, it overlaps community development. And so finding ways to make these interdisciplinary efforts are really important. And I'm seeing that there's a lot popping up in the chat box. I'm not looking at it right now, but I will come back to it in just 1 minute. So I do want to point out that this is one tool, and there are many other tools that can be useful. Jane mentioned the AARP livability framework. I really like that framework. They have a great livability index, which can bring you more information about what's happening in your communities. And as Jane pointed out, this tool that we've created actually fits really nicely into the way that they have their assessment set up. The AARP roadmap to livability is much broader and takes through a much broader process. And this tool really fits into the process of community self-assessment and helping communities figure out what it is that they're doing. Another great tool is the World Health Organization's Aging-Friendly World, which I provided a link to there. That gives a lot of good examples of the way this is happening internationally and globally, and best practices and things that have worked in other communities. And so it is a really interesting resource to look at. I also really enjoy Iowa State's Midlife Study Circles. This is a more grassroots effort. The effort that we're talking about here and the way that we've formatted it is really more policy systems environment, where we're focusing focusing on community leadership to make these decisions and create action steps. The midlife study circles is much more grassroots, where it is neighbors and community center members and small groups of people who get together, identify high priority issues, and then figure out what they can do about it to make changes in that area. So I really love that program, and I actually think it knits in nicely with what we're doing here. And then finally, across the country, dementia-friendly communities and dementia-friendly toolkits have really been increasing in interest and importance. And I like that as well, because that knits in nicely with what we're doing. Dementia-friendly is one aspect of what we need in order to have age-friendly and livable communities, and then expanding that to the other areas that are high needs can also help amplify everything. So when communities are thinking about whether they're dementia-friendly, it's a good time to also think about whether they're aging-friendly more generally and livable more generally. When communities are thinking about their livability and their aging friendliness, bringing in that dementia-centered focus can also be really important to enhancing the quality of life and well-being of everybody in the community. And so with that, I am going to shuffle up to the comments box, and we welcome your questions and your comments. I do want to mention now that we would love to have your feedback on this, and I have a link on the slide, and I will copy and paste that link into the, I actually think you can click it on the slide, but you can please fill out that survey to let us know what you liked, what you didn't, what's helpful, what's not helpful, and give us ideas for future programs.